you can read, the colleagues can read a very famous article published a few months ago on botulinum toxin complications. Well, there were treated 5,000 patients, 5,000 injections, and there were about 300, 400 complications. How many from drugs? Zero. How many from doctors' injections? 400, 100%. So, all the complications from botulinum toxin therapy are from bad techniques. In my opinion, doesn't exist bad luck. You study not thoroughly patients, you inject too many units, you want too much from something that needs less units. So my opinion is that botulinum toxin therapy is a very good therapy. Until now it is probably 15 years that I don't have a complication. So, in my opinion, we must be more prudent, especially in Russian countries, in Russian republics, so it is a little bit too aggressive. Best new indication, in my opinion, is the treatment of the oval of the face. The treatment of masseter muscle, I published a few months ago a new paper that is foundable in PubMed. The treatment of masseter muscle is a really incredible possibility in the hands of the doctors when there is a hypertrophy of the muscle, not when there is the bone that is wide. But when there is a hypertrophy of the muscle, you can get some incredible results. And then another interesting indication is the meso-botulinum toxin, what I call meso-abobotulotoksin. I use quite always abobotulotoksin A. That can give us very good results, especially in these difficult wrinkles on the neck, where when they are mimical, you can dilute in a particular way botulinum toxin and get also here very good results, like in hyperhidrosis for hands, for axilla. This is the same philosophy, meso-botulinum toxin, so very superficial, because if you go deeper, you can get some asymmetries, so it becomes immediately dangerous. So great attention to the technique. Yes. Never I ask patients to pay me for the units, for the hectograms of drug that I give them. But I say always them, and for sure I am not a cheap doctor, that they pay me for my art. So I use 2 units on glabella finished, they pay the same as I use for all the face. Because this is my philosophy. So in my opinion, patients pay because you study thoroughly them. You understand the movements, you understand the perfect balance of muscles, and you give them a good eyebrow elevation, you give them a beautiful smile. All of these little things are done for your experience and the study of patients. Well, there is a very easy technique to mix hyaluronic acid and botulinum toxin when there is a good indication. So you see the patient that has a reduction of hydration, and also some, this coexists in many people, in many patients, where you see these wrinkles because also they are dehydrated, but they move. So in this case, the mix of a good filler, like what I use, very soft filler, and some units of abobotulotoksin A, 10-15 units per side, can be the solution for both the problems. Hydration, so improved hydration, and a light reduction of mimicity. We don't have to make confusion because 10-50 units on a botulinum toxin is a huge quantity. No, I am speaking of abobotulinum toxin, so spaywood units. About 10 units for the one chicken, 10 units for the other. I use a 0.5 ml syringe for diabetes, and I can inject also a little water, some very little amounts of units. So I use meso-D-sport, meso-abobotulinotoxin in those areas where you don't use normal abobotulinotoxin. So in glabella, no, I use the normal, also in forehead. Sometimes when I have a sweating in the forehead, I can use meso-D-sport. Then here, no, but here, the main is cheeks. When I do the touch-up and they smile, and you see that here everything is disappeared, and here you have a very big wrinkles. Other very good indication for meso-D-sport. Then here, then maybe the neck and the décolleté, when you can get some lower results, but anyway you can try. But the best is the lateral cheek.